Let me begin with a simple question. How much water did you drink today? Not tea, not coffee, not juice, just plain water. Most seniors either drink very little water or drink it the wrong way, and as a doctor, I can tell you something surprising. Improper water intake silently worsens blood sugar, increases insulin resistance, damages kidneys, and accelerates diabetic complications, and yet nobody talks about this in detail. After the age of 45 or 50, the body's thirst signal weakens, kidneys become more sensitive, blood becomes thicker due to dehydration, and glucose concentration in the blood rises more easily. So when people tell me, "Doctor, my sugar is high even though I eat less," the first thing I ask is not about food, but about water, because water is not just for quenching thirst, it is a metabolic tool, and when consumed correctly, it can significantly support blood sugar control, reduce sugar spikes, improve insulin sensitivity, and protect organs damaged by diabetes. Now, let me be very clear. Water is not a medicine that replaces diabetes drugs, but it is one of the strongest foundations for controlling sugar naturally, especially for seniors. When the body is dehydrated, the hormone vasopressin increases, which tells the liver to release more glucose into the bloodstream. And research published in Diabetes Care has shown that people who drink less water have a higher risk of developing type 2 diabetes. And among diabetics, dehydration worsens glucose control and increases the risk of complications like kidney damage and nerve pain. After 50, kidneys cannot filter blood efficiently if water intake is low, causing sugar to remain longer in circulation, leading to fatigue, frequent urination, dry mouth, blurry vision, and sugar fluctuations. Now, let us talk about how seniors should drink water correctly, because sipping occasionally or suddenly drinking large amounts is not the right approach. The first rule is timing. How you space water through the day matters more than the total quantity. The day should start with water because overnight dehydration is one of the biggest reasons for morning high fasting sugar. And drinking 1 to 2 glasses of lukewarm water within 15 minutes of waking helps dilute blood glucose, supports kidney filtration, and improves insulin sensitivity for the day. And seniors should sit and drink slowly, not gulp, because gulping stresses the heart and kidneys. The second important rule is temperature. Extremely cold water causes blood vessel constriction and can worsen insulin resistance, while lukewarm or room temperature water improves digestion, circulation, and glucose metabolism. The third rule is spacing. Small, frequent sips every 30 to 40 minutes keep blood viscosity low and prevent sugar concentration from rising, while drinking large amounts at once dilutes digestive enzymes and strains kidneys, especially in older adults. Many seniors make the mistake of drinking water only when they feel thirsty. But thirst appears late in older age, and by then dehydration has already begun affecting blood sugar, so water intake should be planned, not reactive. Now let us talk about quantity, because this is where confusion happens. There is no single number for everyone, but for most seniors with diabetes, a safe range is about 30 to 35 milliliters per kilogram of body weight per day, adjusted for kidney and heart conditions, which usually comes to about 2 to 2.5 liters per day, spread evenly and not all at once. However, people with kidney disease, heart failure, or fluid restrictions must follow their doctor's advice. Now let us discuss something very important: drinking water with meals, because this directly affects sugar spikes. And the rule is simple. Avoid drinking large amounts of water during meals because it dilutes digestive enzymes, slows digestion, and causes glucose to enter the bloodstream more rapidly later, leading to spikes. Instead, drink water 20-30 minutes before meals and then sip minimally during meals if needed, and resume water intake 1 hour after eating. This simple habit alone can reduce post-meal sugar spikes significantly. Now let me address a very common question. Can drinking water lower sugar immediately? Water does not flush out sugar instantly, but it helps kidneys excrete excess glucose through urine and prevents further concentration of sugar in the blood, which stabilizes readings over time. And many patients notice better fasting and post meal numbers within 1 to 2 weeks of correcting water habits. Now let us talk about infused water, because seniors often ask whether adding lemon, seeds, or herbs helps. And the answer is yes. When used wisely, adding soaked fenugreek seeds, chia seeds, or a few drops of lemon juice can slow glucose absorption and improve insulin sensitivity. But sweeteners, honey, jaggery, or packaged flavored waters should be strictly avoided. Warm water with soaked methi seeds in the morning has been shown in multiple studies to help lower fasting sugar by improving insulin action. Now let us talk about kidneys, because diabetes and dehydration together are extremely dangerous for kidneys, and seniors with long-standing diabetes must protect kidney function by maintaining steady hydration, not excessive hydration, because too little water concentrates toxins and sugar, while too much water overloads weakened kidneys. Clear or light yellow urine is a simple sign of adequate hydration. Dark urine means dehydration. Now let me address nighttime water intake, because many seniors stop drinking water after evening due to fear of frequent urination, but complete restriction is harmful. Small sips until 1 hour before bed are safe, and if you wake at night with dry mouth, 1 or 2 sips are acceptable. Now let us talk about something most people never hear: water and insulin sensitivity, because hydration improves blood flow to muscles and liver, which helps insulin work better, meaning glucose enters cells more efficiently instead of remaining in the blood. Dehydration thickens blood, reduces circulation, and forces the pancreas to work harder, worsening insulin resistance. Now, let us address myths. Drinking excess water will not cure diabetes. Alkaline water is not necessary. Bottled mineral water is not superior to clean tap water. And coconut water, although natural, contains sugar and should be limited in diabetics. Now, let me give you a simple daily water routine for seniors with diabetes. Wake up and drink 1 to 2 glasses of lukewarm water slowly. Mid-morning sip water every 30 minutes. Drink 1 glass 20 minutes before lunch. Sip minimally during meals. Drink 1 glass 1 hour after lunch. Repeat the same pattern in the evening. Reduce intake 1 hour before bed. Now let me talk about warning signs that you are drinking water incorrectly: frequent headaches, fatigue, constipation, sugar fluctuations, leg cramps, dizziness, and dry mouth are often signs of poor hydration rather than medication failure. Now, let me end with an important message. As a doctor, I have seen patients improve sugar control not by changing medicines, but by correcting water habits, because water supports every organ involved in glucose metabolism, from kidneys to liver to muscles to pancreas. And while water alone is not a cure, without proper water intake, no diet, no exercise, and no medicine can work optimally. So if you are a senior living with diabetes, do not underestimate water. Treat it like a daily therapy. Consume it wisely, consistently, and respectfully, and your body will respond slowly but surely, because aging with diabetes does not have to mean constant struggle. It means smarter daily habits, and water is one of the simplest and most powerful of them.